One of the difficulties I found is that that when I was diagnosed, I expected from what other people had said that I just have a single doctor that I'd be dealing with, a cancer doctor. It didn't work out that way. What I ended up with was different doctors in different specialities. It was reassuring from the point of view of you know that the best people are looking after you, but it made it difficult from a communication point of view because for a start, multiple hospital trusts were involved, so they're not even necessarily on, talking to each other all the time.
I think it's like a bystander syndrome, that everybody else thinks somebody else is looking after you.
Once you've got metastatic disease, then inevitably that means that other areas of the body are then involved. The problem that can raise is if you want the best people to be making decisions about that, you need experts in that particular area. But what that can also mean is you end up in a situation where patients have to go to multiple different team meetings to discuss the correct management of disease within those organs. And that can end up in a situation where patients can be bounced between MDTs, adding both uncertainty, potentially conflicting information given to patients, but also potentially delay.
I've had situations where I've had appointments booked with different hospitals on the same day where it's just not possible to get from one to the other. And that means one of the appointments has to be cancelled, and that adds delays, and that just adds worry and frustration and stress that you don't want.
What we're trying to do in Manchester is end up bringing the expertise of all those areas together so the patient can be discussed in one meeting, so a more formulated plan can be undertaken, so the patient can have a more seamless treatment journey and can hopefully have better outcomes and better patient journey as a result of it.
For me, I am the living proof that this way of working works because I'm here today. And I think moving up forward, this is what we need to do. We need to get everybody round one table or in one operating theatre, all these specialities in one place, because the outcomes are better. This is the way moving forward it needs to be done for metastatic patients.